Hold on, I'm gonna.
Okay.
1, 2, 3.
Okay, hello. We're going to demonstrate the dermastamping treatment with the recovery serum. This is the dermastamp. It has zero 0.8 millimeter needles in there. And this is the recovery serum. It comes in a vial, and here is 4 milliliters. And we use the entire vial for one treatment. We are going to start first applying the serum on the face.
And you don't prep?
We would prep the skin by cleansing the skin, but our patient today already has cleansed skin. So,
How do you cleanse? With the just regular?
with a regular cleanser, mild cleanser that you have. Yes.
You're gonna be 10 years younger, huh?
It's very risky.
So that's the easier way, really, to use the syringe, huh?
Yeah, I like it. Yeah,
To
because
squeeze it, yes.
Yes.
Well, when the doctor was doing it that one time, he was doing this with the bottle, kind of putting it on his finger and then rubbing it. This looks easier with the
yeah,
syringe.
it's easy.
A little more control.
Makes me more
I'm going to start on your forehead here. And just press it down, straight. No wiggling, no doing any of that, but straight down.
And how much pressure?
How's the pressure?
Oh, it's fine.
It's fine. If it's too much by the client, then just
Okay.
slightly lighter pressure is fine too. And when you see a little bit of blood, you can
Just a little bit of blood, yeah.
go ahead and apply a little bit of the recovery,
So it goes through, right?
so it will start the healing process right away and stop the bleeding. But a little bit of bleeding is fine. Okay, and then here where the wrinkled areas are, you stretch out the skin, and then continue stamping. Little bit of overlapping is fine.
Do you feel any pain, Kevin?
Yes. But
Is
it's a
it's
small
fine?
amount, and
Yeah.
it doesn't last.
That one is a
Once
little
she
bit of a
lifts,
scar.
once she lifts up, I don't really feel it anymore. Yeah, and there is a
Should not
scar.
affect the scar right there from,
It's going to make it better. And he has quite a nice pinkish scar. That means that quite possibly we'll be able to get rid of it. If it was already a white scar, older scar, then it would need a couple more treatments.
So from what I can see, you don't have to be fully aseptic, meaning sterile,
This is sterile.
but the gloves are not.
My gloves, well, you use for one patient the gloves is fine, yes.
Yeah, yeah.
I'm
That's,
using it
it's
only
not
on
sterile.
his skin, and
Yeah, okay.
it's fine to use it.
it doesn't have
but
to be
then,
sterilized or anything.
But then the
No, because there are
dermastamp we
sterile gloves
use,
that you peel off.
the dermastamp we used only for
one
one
patient.
for
One
one
shot.
patient, yes.
Because of the needles.
Okay, I'm gonna continue on your nose.
And you don't
And on your
have,
cheek.
say, HEPA B precautions? You're dealing with say, blood.
But this blood is really minimal, so it's most people don't bleed.
Equivalent to shaving,
Yeah.
So it's not a big,
So the reason that you're doing that, you said, is because you're following the muscles?
Yes, well, I like to follow the muscles of the face, so ladies especially will appreciate it because it kind of gives you a little bit of that lifting effect that you will notice at home when you start applying the active for home care and stuff. Then
So upwards.
the way the elastin then grows back, it will help you kind of give you this lifting effect, just a little bit. So that's why I like to do it that way.
Is that less sensitive, Kevin, down on your jaw, or same?
The one that hurt the most was up by the temple, the side of the forehead.
Yeah.
Because the skin is
Just
thinner
because
there.
it's thick.
Yeah.
Skin is thinner there.
So this procedure you would repeat again in a month,
I would say in 2 weeks is fine.
couple weeks?
Yes. And I'm going to apply afterwards again the recovery. And I'm gonna let you continue on the
Yeah,
other side.
do you have to use a sunblock?
Yes,
Eventually.
you do. I would say not to use it right immediately after the procedure, but definitely the next morning.
Can you wash your face after the treatment or no?
Leave
Leave it on?
No, because you want to leave the growth factors
So how long?
on your
Yeah.
skin.
Oh,
And
I see.
Overnight, you mean?
yes, yes. Okay, and I can have you continue on this side.
And this is highly concentrated in the vial, so how much approximately would you think you would use?
All of it.
The one
So
vial is
first-
for one treatment.
One treatment?
Yes.
Oh, okay.
So first the syringe, right? Do you apply it directly on the face?
Just do it first. Yeah, first apply.
Am I allowed to make a comment to the camera?
Sure.
I like the female touch a little bit.
Vive la de France.
No offense, sir.
I would say vive la de France.
Yeah, just pull it out.
And then the redness it disappears how many?
Oh, he will be fine
Like this?
by yes, straight.
Is not the pressure the same? Or
Yeah, that's about the
You
same.
adjust the pressure with the patient exactly.
yeah. So I go up like this and rub it, or
No, no rubbing.
in this way like this. Stretch a little bit.
Yes, stretch in the areas of where you see wrinkling.
I should take it now because actually right now is where the most result is.
So the redness goes away like for how many minutes?
Probably by this evening he's fine. Okay. Yes, because the growth factors immediately start healing and taking away that redness. So, I mean, he would be much more red if we didn't use any growth factors.
Now between this and the next treatment, you'll use the active.
Active for home care.
And you try to avoid the eyes.
The eye area.
Yeah.
Well, you can go over from here, these areas, because he has a little bit of wrinkling here.
But away from the eye.
Yeah, not on the eye.
Oh.
And important is to go, that's why there's more bleeding, because you're going in at an
Okay.
angle, but really important is to just, go straight.
Right here, this is the main part. It's filling in. Did it fill in?
And then apply growth factors here, and make the,
How you doing, Kevin?
Not
Good?
bad.
You good?
Bad.
He probably applies a little more pressure.
Oh, okay.
No, which is okay, except probably right around that area.
Uh,
It's a little more sensitive, yeah.
Right now you can still see my scalp. Right? Yeah. If it's darker, my scalp.
it is. Squeeze.
So if I let it grow another 2 months, you might see.
So if you were to not use all the product and you saved some in the vial, what's the shelf life
yeah.
of that?
Well, if you don't use the whole thing, you would, seal it and give it to go for the patient. But the shelf life, you can use, if you don't want to use the whole vial, you can use it, take it out with a syringe, because it's closed like
Oh,
this.
okay.
Oh,
So it's got to be
so
sealed.
it's not
So yeah, you want it to be
contaminated.
It's not exposed.
So you can just take it out with a syringe if you want to use half a vial. But usually you would need that.
For the entire
Yeah.
face.
Yeah.
normally.
Do you do the neck also?
You can do the neck as well, yes.
The decollete?
Yes, yes, of
then
course.
you
And then
would-
you will go upwards with the.
And you need more serum
You
then.
can use an extra vial, of course, and then you will have to tell
Store
the
it at room temperature
No, probably in the fridge, but room temperature is fine too.
in the
but
fridge.
Not
And how
warm,
long? How
not
long does
warm.
it stay? When it's not, when it's sealed
When
like
it's
that?
sealed, the shelf life is 2 years for all the products, for the active, for the ice.
All of it.
Open at 6 months, right? 6 months?
Open, yeah, probably, but you will use the product.
Sooner, yeah. You-
1 to 3 months is usually that you use the active.
So what does it feel like, Kevin?
Should a male not shave like the following morning?
Is
Does it make any
Depends how he
sting?
feels. If he feels there's a little bit of
Stinging of the skin?
irritation or
There's a little stinging,
yeah,
but not too
usually
much.
It's fine. I mean,
Maybe just certain spots, yeah.
Now, where his
Like a
scar
sunburn,
was,
huh?
would you redo